Here today is Dr. Edward Flores to talk about the conditions that workers in the Central Valley face during the COVID-19 pandemic, and Dr. Devera Sexton to present her latest research on the conditions of farm workers. First, let me introduce Dr. Edward Flores, a sociology associate professor at UC Merced. Welcome, Dr. Flores.
So the title of my talk is Manufacturing Risk, a regional analysis of workplace compliance in California's meatpacking and processing industries. This is based off of a very short policy brief, a research brief that the UC Merced Community and Labor Center put together, myself and Ana Padilla, our executive director. And the purpose of my talk is to examine regional differences in worker health and safety compliance. In the introduction, I'll discuss how working conditions are intimately tied to COVID-19 transmission, even though some policymakers question the need for regulatory mechanisms and punishment. Our findings suggest pre-COVID-19 inequity in worker health and safety standards enforcement in one of the pandemic's largest hotspots, the Central Valley's animal slaughtering and processing industry. Our recommendations point to the need for better OSHA, Occupational Safety Health Administration, health and safety standards and enforcement to mitigate the spread of COVID-19. So if you have been reading newspapers for the past few months, I'm sure you're familiar with journalistic accounts that suggest those at the greatest risk of COVID-19 transmission are essential workers without adequate social distancing measures at work. Industries with notable workplace outbreaks have included hospitals and nursing homes, but also warehouses, agricultural farms, and meatpacking plants. In Kings County, an April outbreak at Central Valley Meat Company infected hundreds of workers and accounted for the majority of the county's COVID-19 cases. In some cases, workers have organized to track cases, file complaints, and hold management accountable. We saw this with Amazon warehouse workers. But at the same time, management may retaliate against workers for criticizing unsafe working conditions. Public discourse over COVID-19 mitigation, we think, has given short shrift to the role of workplace health and safety standards. Whereas most media coverage focuses on individualistic behavior, such as mask wearing or sheltering at home, or it focuses on prohibitions against large crowds in public. These are all important measures, by the way. But we're trying to point out is that less media coverage has focused on the role of workplace health and safety standards. In July 2020, our report Hidden Threat was cited in the New York Times. The report emphasized the Central Valley as a hotspot of COVID positivity. In a subsequent article that also cited our brief, the governor subsequently appropriated funds for strike teams, particularly in the Central Valley, though he stated that the funds would not be used in a, quote, punitive mindset. California's first COVID-19 workplace health and safety violations related to first OSHA workplace health and safety violations related to COVID were not issued until a few weeks ago. So we've begun researching the question of whether there is a relationship between workplace health and safety enforcement and COVID-19 transmission. And we're going to present on some of that preliminary research today, looking at regional differences in pre-COVID worker health and safety standards enforcement and how the Central Valley compares with other California regions. Okay, so our question is, how do meatpacking industry worker health and safety compliance rates vary by region? We drew from the American Community Survey to get estimates of the number of employees in the meatpacking industry in each of California's 10 regions, one of which is the Central Valley. We used a 5-year data set, which gives us a 5% sample of the American population, and we weighted it for generalizability. We also drew from 5 years of U.S. Department of Labor OSHA records, and there were 182 records for meatpacking facilities in California. Just very quickly, we used occupation and industry variables coding for workers in animal slaughtering and processing, which is NAICS code 3116. And we also categorized the residents of the region of a case based on the county, or if the county was too small, we coded the PUMA into a region. Like for example, Monterey and San Benito are in the Central Coast. We only examined cases that were opened. We only examined those that were closed, that had a closed status. And we looked at inspection type, there's planned and unplanned inspections. The planned ones are less serious. The unplanned inspections have to do with accidents, complaints, or whistleblower investigations. OSHA prioritizes investigations of unplanned inspections higher than planned inspections. And this is based on the severity of the hazard. We also counted the total number of violations of the different types of violations assessed for each of these cases. And so these are our findings. The ACS tells us that the Central Valley has almost half, 45.5%, of California's 20,000 animal slaughtering and processing employees. Los Angeles had the second highest share of the industry employees, 28%. The Central Valley had more than half, 51%, of California's animal slaughtering and processing inspections. Los Angeles had the second highest share of industry inspections, again, 28.4% of 40 out of 141 inspections in the state. The Central Valley has the highest rate of animal slaughtering and processing inspections in the state, as you can see in this graph. Between 2015 and 2020, the Central Valley had 7.9 inspections per every 1,000 employees in the animal slaughtering and processing industry. The Bay Area and Los Angeles had the second and third highest rates of industry inspections at 7.4 and 7.0 per 1,000 employees. We also observe large regional differences in the type of inspections by region. The Central Valley had only 1 in 10, 11% of the state's planned inspections, but nearly 2 out of 3 of the state's unplanned inspections. And again, these are accidents, complaints, whistleblower investigations, those that OSHA prioritizes as being the most severe. We can see that a large number of the state's industry inspections are clustered in the valley, and how such a large majority of these in the valley are unplanned. Okay, now this is the most significant data point that I wanted to share today. While the Central Valley had the highest rate of inspections in animal slaughtering and processing, it had among the lowest rates of violations per inspections, 1.3 violations per inspection, 91 violations for the 72 inspections in the region in those 5 years. By contrast, Sacramento and San Diego Imperial Valley regions had rates of violations per inspections above 4. Los Angeles averaged 3.8 inspections per violations, and the Bay Area had 2.8 violations per inspection. The only regions with lower rates of violations were the Sierra, which only had 2 inspections during those 5 years and got 2 violations, and the Central Coast, which had none. We're not sure that they even had any industry employees. Okay, so we started this presentation noting the central role of the workplace and journalistic accounts of high-profile COVID-19 outbreaks, particularly in meatpacking, and the reluctance of policymakers to take a punitive approach to mitigating workplace COVID-19 spread, despite the large concentration of COVID-19 cases in the Central Valley and in meatpacking. And in this study, we asked how do meatpacking industry worker health and safety compliance rates vary by region? And using the ACS and OSHA records, we found large regional differences in meatpacking investigations and violations, particularly in the Central Valley. While the Valley had had California's lowest rate of violations per inspection, strikingly, it also had the highest rate of accident, complaint, and whistleblower-related investigations. And we interpret the contradiction of the Valley as having the lowest rates of violations and the highest rates of high-priority inspections as indicating non-compliance. Despite low rates, following low rates of violations, Valley meatpacking plants continue to experience high rates of accidents, complaints, and whistleblower-related investigations. So our policy recommendation, our work points towards the need for what is currently being developed, an OSHA COVID-19 emergency temporary standard, as well as dedicating resources for equitable enforcement across regions. And we would love to hear feedback and questions. Thank you.
Thank you, Dr. Flores, and we really appreciated that. Now I'd like to introduce Dr. Deborah Saxton. She is an anthropology associate professor at CSU Fresno. Welcome, Dr. Saxton. Dr. Saxton, are you there?
I am.
There you go. Excellent.
So I want to thank the HEAL Collaborative for having me. I am here talking as one of many researchers, community-based organizations, and that are part of the COVID-19 farm worker study. The preliminary results of the survey data for this study can be found at covid19farmworkerstudy.org. And this was all brought together very rapidly, starting with conversations in March of this year by the California Institute of Rural Studies, which is an independent nonprofit research organization. We call our study the COVID-19 Farm Worker Study, or the COFS for short. And right now I'm focusing on some of our findings from the California portion of the study. There are also sorry, let me fix one thing. Okay, so the study started with a quantitative survey of over 900 farm workers throughout the state of California, and it was designed in collaboration with the California Institute of Rural Studies and several farm worker serving community-based organizations. The community-based organizations in both the quantitative and the qualitative portion of the study, which is what I'll talk about today, phase 2, did most of the data collection, did all of the data collection. So they did surveys for part 1, phase 1, with over 900 people. And then we did a follow-up focus group to find themes that then inspired the design of the interview protocol for phase 2. And our goal for phase 2 is to collect 84 to 120 in-depth interviews with farm workers who also participated in the surveys. So I want to share a little bit about what we're starting to see with the qualitative data, although we're still collecting interviews. We hope to wrap that up in October and to have a report in time for Thanksgiving to really hit home to policymakers and others who are responsible for the death toll and harm of this pandemic to really see what's happening. So we already know from other presenters that have gone and from our general knowledge of farm work and agricultural labor, it is one of the most dangerous occupations as it is. And our findings, not surprisingly, show that COVID-19, the pandemic, is only exacerbating those vulnerabilities and risks. One highlight is that in Monterey County, as of late July, we found that our research team found that agricultural workers were 2 times more likely to become infected with the COVID-19 virus than workers in non-agricultural industries. And I would suspect that that's similar for other counties. However, it's been very difficult to get occupational data from other counties because not all counties, Monterey is exceptional in that it's one of the few that actually collects occupational data when tracking cases. And so I think we need more of that as a policy recommendation, not just for the pandemic, but for all kinds of pre-existing and ongoing industrial harms and hazards. So here are our California partners, and these were the regions of California where survey data was collected for phase 1, and we collected the data based on proportions of farm workers in geography. So most of the surveys were collected in the Central Valley. And based on the findings of the survey, some of the recommendations were that some of these are pre-existing to the pandemic too, but have now more urgency, that we need to expand healthcare access and coverage regardless of people's immigration status. We need to create multilingual, non-academic, and culturally appropriate information, not just for farm workers, but for employers and members of the general population. I think I'm having technical issues with the present function. I keep hitting present, but it's not apparently visible for you all. Let me try to figure that out. I've hit it a few times. Can people not see?
We can see your screen, but it's very, very small. So it's not in a present mode.
Okay. I'm sorry, I don't know how to fix it. I've hit a present button. Let me see.
There you go.
All right. Sorry about that.
That's okay.
We need to expand income and safety net support, again, regardless of people's status. And we need to be more intentional about involving community groups and organizations that people trust, because levels of distrust, not just with the government, but with healthcare institutions and with outsiders, is very high, and I think justifiably so in some cases, because people's experiences with these institutions, particularly of late, have not been healthful or positive. So we need to recruit people that are part of these communities to design and implement programs and supports for people rather than doing it top-down style. An example of this is, while I'm sure there were good intentions with the release of disposable masks, specifically for farm workers by Gavin Newsom several months ago, farm workers were very quick to comment that these were pretty useless because they only lasted one time, if that they disintegrated pretty fast. They're not designed well for outdoor work, especially in the valley where it's super hot. And so they corrected that, but I think if there had been more dialogue from the get-go and more empowerment of CBOs or space for CBOs to make these commentaries at the policy level from the get-go, that some of those mistakes could have been avoided. We also need to ease barriers for farm workers to report COVID-19 related complaints. As of right now, it's a very bureaucratic, multi-tiered process similar to workers' comp. Or making a complaint to OSHA. You don't automatically get results. It depends. It's too cumbersome for people, even people that are native speakers of English. So it's way worse for those who are not English speakers. And finally, to simplify access to support services. So again, our goal with phase 2, with the interviews that we have going on in process, are to collect 84 to 120 in-depth interviews and to have our analysis and preliminary report by Thanksgiving. I've chosen one quote from one of the interviews as sort of a teaser about that I think really exemplifies the multi-layered ways in which the pandemic is heightening risk and vulnerability for farm workers like Carlos, who works with beef cattle, taking care of calves. And so Carlos tested positive for coronavirus in late July, and his experience was that when he told his employer, as he was instructed to do, by his healthcare providers at Kaiser. The employer who had expressed his disbelief of the pandemic told him he could only have 3 days when the recommendation was 14 days of quarantine. And if he felt okay, he'd had to come back to work. If he stayed home, he wouldn't have earned a salary. So again, some employers are denying workers their rights to workers' compensation. And in this case, it's fairly likely that he contracted it at work because there were cases prior to his case. I told him, I feel the symptoms. The doctor told me I have to quarantine for 14 days. My boss said, you look fine, just let your coworkers know and go back to work. At home, I tried to quarantine, but at work, I had to tell my coworkers that I had the coronavirus. That's what he told me. But when I told them I looked okay, I didn't have a fever, but I couldn't breathe and I was weak. And I kept working. Many other compañeros or coworkers had symptoms and kept quiet. One had it at least from the July 10th, and he's still in a coma as of early September. Le dio fuerte la enfermedad. He got it bad. I usually work with one other person to tend calves. So from this, we see not only employer disbelief, but the structure of how workplaces are designed in this case. Unless you're masking and taking other precautions, it's very difficult to maintain social distancing. And I think there's been resistance from industry in agriculture writ large about creating some of these and enforcing some of these because it slows things down. But because things weren't slow before, there were risks before coronavirus, and now those are intensified. So I think this brings to light the attention to need to rethink our food system more broadly, although that seems like a very overwhelming thing to do. I think it's a very urgent thing that we should start doing now. The testing experience was also notable for Carlos. It was terrible. At Kaiser, they looked at my throat and then did my nose and then the other nostril. It gave me a headache and watery eyes. I waited 7 days for the results. For our youngest daughter, she waited 15 days. I found out my results through the Kaiser app on my phone at 5 in the morning. All it said was positive. So this is another issue in terms of our testing infrastructures. And this isn't a specific critique of Kaiser per se, but even the state, particularly the state testing centers. It's a very impersonal way. There isn't much conversation or effort to make people feel at ease when they go in for their test, which is a very intimidating process. And for the state centers in particular, you're not talking to a person to make your appointment. Even if you use the phone, you're talking to a robot, and a Spanish-speaking robot at that, with a bad accent. So it's been very challenging for workers to want to do the right thing to make that happen because of how our systems are designed. And he also mentioned that nobody followed through with contact tracing, and not for him personally, nor people at work. And it would have been great if they'd done so people could stay safe, but it didn't happen for some reason. So we need to bolster that and strengthen that. And I'm happy to hear about the COVID Equity Project in Fresno County, and I'm hopeful that that will help. And then in the aftermath, it's totally changed our lives. I try to hang out with my daughters, but sometimes being together all the time makes us more stressed. We can't go to parks, we can't go for walks. We might try hiking or fishing. The river where we used to go is packed with people all the time. We go and we see and we turn around. Hiking too is also full of people. So even trying to take care of yourself after you've been sick and you've been cooped up for months and months and months, with children, young children involved too. This reiterates another equity issue, longstanding equity issue with respect to equitable access to green space, which is even more constrained now that more people are going outside, but it makes it less safe to go outside in these public green spaces. So from just thinking about Carlos's illness narrative and experience with COVID, I would say we have to now improve testing processes and turn results around and have better and more personable follow-up contact and care. We need consistency, county to county, community to community with contact tracing teams. And we need to heighten pressure on employers to comply, whether they believe in COVID or not. And so while there may be disbelief and fear in Latino farm worker communities, there's also a different kind of disbelief in the communities that represent employers that I think is under-addressed. We need clear educational messaging for Latinos and everyone else, and better support for family and community caregivers, improved safety and access to already limited green space, and we need a plan to sustain aid and support for the long haul, because this isn't going away anytime soon. And these are the values that should be our new normal, not just for COVID, but for forever and always. So I thank you for your attention today. The lead for our project for the COFs is Ildi Carlisle Cummins, and her email is there, and I will post my email in the Q&A if anyone wants to follow up with me individually about the COFs. But I also encourage everybody to look at the website for the preliminary quantitative data, and hopefully the preliminary qualitative analysis report will be up around Thanksgiving. Thank you.